One particular type of machinery is the new robotic hair restoration machines that are out there and are being utilized by a lot of different practices to assist the surgeon in the harvesting portion for doing what's called a follicular unit extraction. Some of these new machines that are, again, robotic machines have been utilized by physicians so that they don't necessarily have to do much of the work. So again, it can be a double-edged sword. And one of the reasons I thought it was very important to talk about this is because most of what I try to do with my videos when I'm discussing anything in hair restoration surgery is to make sure that it comes across as intended, which is for patient education. I really want my patients to understand what's going on in this field as I do and as I see it. Even in my own market, I've seen changes, and I've seen physicians who have purchased machines to assist them in doing hair restoration surgery. Anybody who wants to do hair restoration surgery, I applaud them. I think that's a great thing, as long as they're well trained and as long as they're doing good work. I think competition is a good thing. But all too often what I'm seeing is patients are coming to me and they're telling me that they've gone to see Dr. X because they have a robot. And that's great. I think technology is a wonderful thing. But in the eyes of the patient, what they're seeing is, well, this must be cutting edge. This must be the most advanced technology out there. And that must mean that this doctor really knows what they're doing. And there's times when nothing could be further from the truth. So what I've seen come through my office on more than one occasion, quite often now, is the patient that is trying to get more information. They're trying to educate themselves. And they'll show up to me, and I've always been very honest with my patients. One of the things I think I'm very well known for is being very truthful and very fair with patients about whether they're a reasonable candidate or not. And I would tell you, we turn away a good 50 to 60% of the patients that come to see us because they're not, at least at that time, appropriate candidates for surgery. When I'm looking at a patient, I'm having to make a decision as to whether or not the patient's donor hair is adequate, whether or not they're going to be able to get the type of response that they know that they want, or we know that they want, what they're looking for. And I can tell that by examining a patient's scalp. I can tell that by the quality of their donor hair. And I'm seeing this more and more often where patients will come in, and it takes time. I have to sit there and I have to educate them and explain to them that, listen, just because somebody has a machine or has a robot doesn't mean they have the first idea of what to really do to produce a quality, high-level grade of hair restoration. And I think that's one of the things I feel is a responsibility as the president of the American Board of Hair Restoration Surgery. It's incumbent upon me to really make sure that the public understands, number one, what we do, but number two, why we do it. It's clear to me that many patients have not been properly educated about what these machines are for, what do they do, who uses them, why do they use them. It's very important that they understand this. There's plenty of surgeons that will buy a robot, and they're good surgeons. They're good qualified hair restoration surgeons that have diplomat status through the ABHRS, and they see this as a very useful tool for their practice, and I certainly can't deny that. Unfortunately, what I've also seen, these machines ending up in the hands of physicians that, no disrespect to them, but they have no business doing hair restoration surgery. But because they're well respected in their particular field, they feel like, well, this is just hair. How hard can it be? Well, let me tell you, the truth is, I'm the guy in Austin that's fixing those cases. When they come to me and they say, I had X number of grafts supposedly done, and I got little to no growth, and then I have to explain to them, well, because you probably weren't a really good candidate to begin with.